everybody. My name is Sue Falsone, and I'm a physical therapist, athletic trainer, strength coach. Worked at Athletes Performance, which is now known as Exos, for about 13 years. I was with the LA Dodgers for 6 years. I was with the U.S. men's national team for about a year. And now doing a whole bunch of different things, teaching a whole bunch, lecturing, and working at a facility called Unbreakable Performance Center as well. So a lot of different things going. My primary group of people that I work with are professional athletes. That's pretty much all that I deal with. And so the stuff that we're going to talk about today and I show you is really going to be just the stuff that I do with the guys. So a lot of exercises that we do with them are really kind of I have kind of a yoga background, so a lot of my stuff is more yoga based, especially when we're dealing with the cervical thoracic junction. It's such an area, right? Whether you're dealing with athletes, whether you're dealing with your average patient, your average person, everyone's got poor posture. They're on their phones, they're on the computer. That's just like such a common area of tension for everybody. And so really being able to combat that area, decrease tension, you can only massage and trigger point stuff so much. If you don't activate something else, you're never going to be able to decrease the tension in that area. So we're going to talk about some other activation stuff, go over some of the exercises that I like to do with people that have that issues, and go from there. I'm going to be using the CLX today. For me, the CLX is huge because my entire practice is on the road. And so I don't have the ability to bring a ton of equipment with me. So if I can just bring one band with me and take the CLX, and not have to worry about also having handles or doorknob anchors or anything like that. I can just have one piece of equipment and really am able to do anything that I want to do with this one piece of equipment. So it's really, really versatile, and that's important for me in my practice for sure. So one thing that I notice with my people that are having cervical thoracic junction issues, go ahead and flip around for me, Phil. Exactly. He's got that poor posture, right? And so this is where all the tension is created. So if we can work, first of all, on people's posture, to me, that is an absolute huge thing to do. You cannot out-rep bad posture. You just can't. Right? I can't prescribe enough exercise in order to outdo his poor posture. When he's not with me for 23 hours a day, if he's like that, everything I did for the last hour isn't going to matter. So to me, when we're dealing with the CTJ, posture and postural education is number one, super important. Again, when people do tend to have that posture and tend to have all that tension there, we can trigger point, we can massage, we can do all that stuff. If we don't the body likes homeostasis, right? The body is always going to seek stability. So if we don't give stability back somewhere else in the system, this is just going to get tight again, right? So we can massage and do all that. If we don't give stability back somewhere else, this is getting tight. So for me, I love this next exercise we're going to do. I'm going to have you flip around, Phil. This is going to go up and under you. Grab underneath, perfect, okay? And you're going to go ahead and put your hands in one loop and give yourself enough tension to go in there. So I want him to have his hands extended. That's the other thing I love about the CLX is he doesn't have to grip the TheraBand. If I'm trying to do some type of posterior chain exercise, I want to have a finger extension, wrist extension. I want to kind of promote that whole extension pattern. So when they're gripping a band or gripping a tube or gripping a handle, it's kind of reflexively bringing people back into this position. So with the CLX, I can have his hands open, his fingers open, reflexively get a little bit of activation of the posterior chain as well. So what this is doing really is giving him an external serratus anterior. That's really what I'm trying to get here. So what he's going to do, he'll have his hands like perfect, and he's going to give a little push out, right? Not a ton. So back off just a tad. There we go. So just a little bit, just to engage that muscle a tad. Now he's going to maintain that as he elevates, right? If he does this, yep, perfect. Come back down. So as he's doing it, keep going. Really, really great for people that are dealing with shoulder impingement, any type of CT junction issues, because I'm getting him to depress those shoulders and focus on the upward rotation, as opposed to, we've all seen those people, especially post-op, they're doing one of these things, or they're just so tight and tense, everything they do recruits that upper trap. So if I can activate a little bit of the upward rotation, that's huge. If he does it wrong, this thing flips up and it hits him in the back of the head or gets caught in his hair. So if he had hair, it would get caught in his hair. So it's kind of a self, I don't know what the word is. It's just a way to make sure that he does the exercise correctly. I don't have to coach him up, right? The more you tell people, don't do that, keep your shoulders down, they can't resonate with that, right? So if you give them something where they have to keep their shoulders down, because if they let their shoulders go up, the band's going to roll up into the back of their head. So it makes him do the movement properly. That's number one. Number two, we're going to get down on the ground. Not necessarily what these are made for to use, but I use them for pillows all the time. Because I want his face to be parallel with the ceiling, right? I don't want him going into a ton of neck extension. So based on the shape of his body, based on the shape of his head, where he's holding his shoulder girdles, we may need to put something under their head so they're not going into cervical extension. Next, what I'm going to have him do, so many people get tight and tense in this area because, again, they're trying to seek stability. So we have to give stability back into the system somewhere else. So I'm going to have him take a deep breath in, and he's going to breathe out, and he's going to breathe out all the air he has. Breathe out, breathe out, breathe out, breathe out, breathe out even more. It's hard, it's uncomfortable, and rest. Taking another deep breath, and breathe out. Breathe out, breathe out, breathe out, breathe out, breathe out. Keep breathing out, keep breathing out, keep breathing out. That forceful expiration makes him utilize his external obliques and his internal obliques. That's going to put him in a little bit of thoracolumbar neutral, okay? I don't necessarily want thoracolumbar flexion, but I am trying to get some thoracolumbar neutral, okay? We can kick in those external obliques and internal obliques by using that expiratory reserve volume. Start to give him a little stability back down here so this can relax. That's the first part. Second part of the activity now is to challenge it a little bit more. I'm going to have him put his hands, both hands for me, in a 90-90 position. What that does now is it makes him go into thoracolumbar extension. So now we got to challenge him again. I need his ribs to be pinned down. So as he blows out, blows out, blows out, I want him to make contact at the thoracolumbar junction with the ground. And he's got to maintain that. I want him to feel that. So you don't have to keep having him exhale all the time, but it does help to maintain a little bit of contact there. Once he's able to maintain that contact at the thoracolumbar junction, perfect. So now we're going to challenge him even more. He's going to keep contact with the thoracolumbar junction into the ground, neutral spine. He's going to take in a breath here. As he breathes out, his hands are coming up. And he is going to inhale, bring his arms down. Exhale, arms go up. So now we're challenging that thoracolumbar junction even more. As he raises his arms up over his head, he's going to want to extend at that thoracolumbar junction. We want him to keep that neutral. So that's going to be hard for a lot of people, right? Awesome. And rest. And now if we want to make this even harder for him, we add in a little bit of CLX action. Okay. Have him put his hands in one of the loops at the end. There we go. Ideally, you make sure it's even on both sides for time purposes. I'm not going to worry about it. He's going to go back into that position again for me. So back into that 90-90 position. Now, again, we're assuming he has conquered every goal up to this point, right? So he can maintain thoracolumbar junction in neutral. He can maintain it when he's here. He can maintain it when he's doing this. Now I'm adding resistance to him, okay? So same thing, he's gonna inhale here. He's gonna exhale as he goes up. That's gonna be challenging for a lot of people, right? So again, progressive, making your activities really, really progressive and systematic in order to continue to challenge the athlete. Perfect. If we wanted to challenge him even more, I would take the band off, right? But we'll just take it out of his hands. Extend his legs. Repeat the process, because now we toss him into an anterior pelvic tilt. So now we're challenging him again. And then we can repeat the activity with the band, but now we're obviously adding in a lot more resistance. So again, continuing to be progressive. Awesome. Good. With the throwers, with any of my patients, really, any of my athletes, I try to do a lot of big bang for your buck stuff. So very rarely do I just attach a CLX or something to a door handle and have them do isolated external rotation. There is a time and place for that, right? If someone is post-operative, if someone is in a lot of pain, there's a time and a place for that, but oftentimes that's not necessarily what I'm working with. I want to work on a lot of different things at the same time, because the athletes they're gonna see something shiny and they'll be gone, so I don't have a lot of time with them necessarily. So we're gonna do a side plank. So what he's gonna do, and you can modify this. You can put one leg in front, you can just go up on your knees, however you wanna go up. So go ahead into that side plank. So we're gonna make sure he's got a neutral lumbopelvic hip complex, right? We're gonna make sure he's in a neutral position. I'm already challenging him a lot. With relation to the cervical thoracic junction, I love this side plank position. Go up again for me. When he's here, actually, you know what, I lied. Turn around, face me, and do the same thing. So when he's in side plank, he can't have this thing up in his ear. He has to work on depressing. This has to be connected with this, through the lat, through the teres, through the serratus. This has to be connected. So that's huge for him, and rest. In order, again, to decrease the tension here, we have to give the body stability somewhere else. So that is really, really important. Then I'm going to add, you can flip back around. Put that through your hand. So now if I want to work on scapular activation, muscle activation, rotator cuff, whatever I want to do, he goes up in that side plank, right? His elbow comes away from his body. There we go. And keep your elbow bent, you're just going to go external rotation. There we go. I can do whatever I want him to do in this position, really. Challenging now not only the stability on the bottom side, but controlled mobility on the top side. So big bang for my buck. And rest for me. Good. Awesome. Any questions? It's just a smattering of kind of some of the things that I do with cervical thoracic junction issues, but any questions on what I've shown or other things that I do or anything at all? Awesome. Thanks for hanging out, you guys.